Well, I'm going to ask Mark here because it seems odd to some people. We're asking a dentist about migraines.
Right.
But you can help here.
Absolutely.
With some people.
Yeah. I mean, going back to what's just been discussed is that migraines are so multifactorial. Like a lot of diseases, there's so many different factors. But as we are looking deeper and deeper into different causes, we certainly are seeing for some people that there's a muscular reason or musculoskeletal reason around our jaw joints, because the muscles all around here where some people get the migraines are linked to the jaw joint, and this is obviously linked to the upper and lower jaws. And if those two jaws are out of balance, or the joint is out of balance, then potentially some people, if they're very sensitive, can get these spasms, quite often linked with lack of oxygen or a cramping.
So they might need to
it's like a
have it
cramping in the muscle.
straightened or something?
Well, first of all, they'd have to just have the muscles relaxed and released by wearing a piece of plastic between their teeth.
Go on, show us it.
Oh, well, believe it or not, I'll make a confession here. I'm a migraine sufferer, and I've been questing for in many areas, many directions, but I used to get only about 4 a year, so it was tolerable. And the only way I could cope would be just to walk all night. I just go outside and I walk. Rain, snow, sleet, whatever, I'll just walk. And that's changing my focus. That's the only way I could change focus, because it was such a throbbing pain. I've been wearing my own splint, which is a piece of plastic.
Yeah, we're going to see this.
This
is a well-worn.
A well-worn one, as you can tell. I've been wearing it for 1.5 years, and in fact made it myself.
Right.
And since been wearing it, I've only had one migraine. So whether this is just
so when do you wear this at night?
I wear it at night and as much as I can in the daytime as well. So even while I'm treating patients, I'm often wearing it. The reason why I've been wearing it for a year and a half.
They've noticed, because put it in while you carry on
Oh yes,
talking.
you'll hear me.
You
Very
would notice.
sexy voice here. Hello, Tony.
Because people probably notice when you've got that in, don't they?
Absolutely, yes. As all the viewers are now noticing. It's a bit lispy. However, it was a lot worse when I first put it in. And some people will not wear it that often during the day, but as long as they wear it at night time, that will be very helpful for a lot of people. In fact, let me just take this out a second. Yeah. In fact, there was a recent research program where in Ireland, wasn't there? The Professor Lamy actually created, I think there's something like 70% of migraine sufferers had relief during the 1 year of wearing their splint.
So that's one possible way.
Exactly,
we're running out of time. Rebecca, what should someone do if you get serious migraines? A lot of us sort of just end up using more and more of these various patented painkillers. Should you go to a doctor? Because a lot of people think, well, it's a migraine, there's nothing they can do about it.
I think it's so important to go and get it checked out. You need to make sure it is actually migraine you're suffering with, and also that there are not other factors actually involved. So go and see your GP. Then what they may recommend is they may recommend over-the-counter products. So, I mean, there's a range here on the table. Or if it's very severe, as Michelle has mentioned, it could be that they'll prescribe something for you. If people are suffering very badly, I mean, there's a whole sort of number of people